Welcome! Anne-Marie here on behalf of the Chronic Pain Association of Canada. It pains me, pun intended, to be the bearer of bad news, especially to start off the new year. I have something to tell you that you're not going to be happy about. I feel confident that you will be unhappy about this because I'm certain that I would feel the same. Nonetheless, please don't shoot the messenger. But before I get to that news, I want to give you an update on a couple of Canadian pain patients that you've been following with us. Both have been forcibly tapered from their opiate pain medicines, and both with disastrous results. Remember Beth? She was born with a rare form of cancer, and following intense chemotherapy and radiation treatment as a toddler, she has been a severe pain patient all of her life. There is no cure for Beth's pain, and she has been through it all, trying every treatment that came her way to no avail. The only option left for her is prescribed pain medications, which have been forcibly tapered to about 20% of her original dose that she had been taking for a decade with good benefit and no ill effects. I've included the links to her interviews so you can refresh your memory. Well, after years of waiting to get to a pain clinic that was a 4-hour drive and sitting through hours of listening to doctors and professionals tell an auditorium full of pain patients that they would be taught how to live with their pain and be clear that no one would be trying to decrease it, she was finally told that it would make sense to have her pain medications reinstated to a level that made her pain more bearable until she wasn't. One physician did tell her this, but it didn't happen. And then she was made to go back on this epic journey yet again for more talk and lectures. And another doctor told her that no increase would be coming and that no doctor would ever say that it would. Realize that Beth's mother attends every appointment with her and is a witness to all that is said and done. After the driving, sitting, listening, etc., which all served to increase her pain, the pain clinic was a total fail for her and put her through a lot of mental and physical anguish. Now get this, her trusted pain doctor was under audit yet again from the Ontario College of Physicians and Surgeons. Remember the ones who said that the investigations were over? And once again, Beth was sent to an addiction specialist. Ironically, this specialist was the voice of reason and of medical help. He told Beth that he was disgusted that she was sent there yet again to go through testing yet again, to tell her and her doctor yet again that she is not an addict. Next, this doctor sent a letter to her trusted pain doctor advising him to titrate this woman back up to a therapeutic dose of pain medication where she's comfortable and functioning as she once was. Now, as shameful as this all is, the trusted pain doctor has more ammunition to treat this patient as a patient to show to the college. So she has an increase now to about 40% of her previous medications, but is nowhere near the function and relief that she used to have. Will this continue? Only time will tell. Now, you remember our retired veteran and police investigator who spent a lifetime protecting our country, Dan. Dan is riddled with whole body pain from an injury and unrelenting arthritis. He can barely walk at this point. He is also diabetic. Check out the links to Dan's previous interviews to refresh your memory. Dan was forced to less than 50% of his pain medication that he had been taking for over 20 years with good benefits and no ill effects. Well, this past December, his diabetes doctor was simply aghast at the state of his health and told him in no uncertain terms that this out-of-control diabetes would kill him. If you remember from the year before, this doctor told him that it was imperative to get this pain under control as it's ramping up his diabetes. It's well known that unmanaged pain will negatively affect comorbid conditions. His pain doctor's response to this? Tell your diabetes doctor to get your diabetes under control. And once again, CPAC had been made aware of a major mockery being made out of a sufferer's pain. And this is what we are calling our Canadian medicine? Well, in December, directly after the diabetes appointment, Dan contacted me before a regularly scheduled appointment with his pain doctor to role play what might be the most effective way to impart to him that denial of effective pain control is killing him. In other words, how best to beg to be treated for your suffering. Dan waited an hour for his appointment, and before he could get a word out, he was fired. Yes, our Dan has his health plummet to a dangerous precipice, his pain soared to dangerous levels, and then was fired. I ask again, is this what we're calling Canadian medicine? Now, Dan was actually referred to another doctor that is registered as a family physician with the provincial college. Dan already has a family physician who will not prescribe for him. It seems his team of doctors all know that he is failing to thrive, yet no one is helping him. What's to happen with this new doctor? We don't know, nor does he, and only time will tell. CPAC is contacted regularly from patients nationally who have been forced into more suffering for no medical reason. We have asked Health Canada to begin and understand this as step number 1, to make a public apology to pain patients. Why do this? Because it sets a precedent. Governments make public apologies all the time. Why? Because it sets a precedent. It tells the entire country that they have made a mess and will now begin to clean it up. Health Canada would be telling every provincial college, every physician, every policymaker, every media person, and every patient that they have made a grave error and that this is not acceptable. That this unethical medical treatment must stop and must be put right for the health of every Canadian. That would be a first step in the right direction for Health Canada to step up to the plate, accept responsibility for the harms that have been done, be the leader they are supposed to be, and let the country know this must be corrected. However, thus far, Health Canada remains silent, still hiding behind a false narrative. I'm quoting Dr. Lynn Webster here in saying that our government, colleges, and media are caught up in a social fever to cast blame for the destruction that substance abuse can cause. Social fever. Isn't that a great way to frame this? You get a fever when you're sick, and this is sickness imposed on us by politics and emotion. It is much simpler to accuse doctors and pain patients of causing this so-called opioid crisis than it would be to try to correct the social disparities that are the precursors of substance abuse. Problematic drug use is driven by poverty, trauma, isolation, and abandonment, to name just a few factors. Being in pain is not one of those factors. What would it take to start the new year with the most simplest of actions? Tell the truth. There are approximately 2 million Canadians which have no other option for pain control except opiate medications, simply because nothing else works for them. There is no current alternative. As our population bulge continues to age, that number will likely increase. And it's not only chronic pain patients that are being denied treatment as the unique patients that they are. If you have acute pain, chances are you will not be relieved of that either. Due to bad and misguided policy and draconian measures to enforce it, patients in pain have never been worse off. Now get this, after all we've been through at CPAC, trying to get the truth out there, I'll provide more links for you, we're being told yet again that there is some large body of evidence-based research that Health Canada and others continue to look to, which tells them there is still need of yet more restriction of medications, even in acute circumstance of pain due to a high chance of becoming addicted. Well, this is just unbelievable at this point. And I bet you guessed what's coming next. Yes, we are trying to gain access to this large body of evidence. And every Canadian, pained or not, should be outraged at the government interference between you and your doctor and demanding to see the material that they are using to obstruct your health care. What will it take for Health Canada and the multitude of other players at the taxpayer's trough, which is a problem in itself, to tell the truth and restore care? Okay, so now here comes the bad news. And I'm sorry to have to say it, but it needs saying. If you've been following our campaign, you know how dedicated our volunteers are, including myself. However, I will not be getting Health Canada and the colleges and everyone else involved in this false narrative to tell the truth and do the right thing. And there, I said it. But there's more. Terry, our president, and Barry, our executive director, will not be getting Health Canada, the colleges, and everyone else involved in this false narrative to tell the truth and do the right thing. And it gets worse again. Our volunteers, some of whom are pain patients themselves and work to exhaustion, well, it's sad to say that they won't be doing that either. And now I'm going to give you the reason that we're not going to be doing this. It's because we cannot. Please allow me to repeat myself. It's because we cannot. I'm speaking to all Canadians now, and please listen because this is truly important. We are but a handful of volunteers without funding or outside resources. Some of us are pain patients, and some of us have other jobs that we need to keep. Everyone needs to know that CPAC is not some limitless organization with a full floor in a high-rise building filled with people working full-time to advocate for pain patients. Our main computer is a desktop which is 12 years old, plus there's a landline for a telephone. We do all of our work from our homes when we can, and we simply and utterly cannot do this alone. We simply and utterly cannot do this alone. There are approximately 37 million Canadians, which means there are about 9 million pain patients, and roughly 2 million of these require prescribed opiate medicines. That is a lot of patients. Nothing will ever change until this large segment of our country can get it together and advocate for change as one group. It's really as simple as that. A handful of people spread out here and there cannot make change for the whole country. Please understand that. You all need to join in and do your part, and if you cannot, have someone do it on your behalf. Numbers matter. That's all that matters when you're trying to change public policy. If you really care about pain, and we know full well that you do, then you need to join with us, and together we will tell the truth and demand proper medical care as the individual and unique patients that we all are. Imagine what would happen if Health Canada had 2 million people knocking down their door. We can help lead the way, but without real numbers, this is futile. Our tiny group does not make for a loud voice. I really hope you can understand this. So if you're serious about change, then let's hear from you. Join us and let's really get the ball rolling. Imagine what could happen with 2 million people clamoring for change. We would be impossible to ignore. That's where we need to be. So many and so loud that we would be impossible to ignore. That would make the truth impossible to ignore. I'm asking you to get ready for yourselves and for those who haven't even been diagnosed yet. No organization can be a leader without followers who are on board. What is CPAC about? We're about telling the truth, and that includes that pain patients, such as myself, are not addicted to anything, not abusing substances of any kind, and not responsible for other people's addictions and tragic deaths. So let's get it together for now and for our futures. Join us, as we have always embraced that when it comes to chronic pain, the treatment is whatever it takes. On behalf of the volunteers and all of our families at CPAC, we wish you and your family a healthy, happier, and more just new year. We are looking forward to hearing from you and to a proactive and progressive 2020.